We're going to talk about the piercing that launched the modern body piercing movement. For the most part, it's the most responsible. Navel piercings, pros, cons, advantages, disadvantages by a piercer. We're also going to talk about what you should know beforehand, getting the piercing done, healing the piercing, jewelry, living with the piercing, and what happens if you say, I'm done with this, and take it out. Coming up next on Pros and Cons by a Piercer, Season 2, Episode number 24. So you might want to stick around. For those that are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So, when I talk about these things, I'm talking to a level of expertise that comes from me in the body piercing industry for well over 27 years. So what we're going to talk about today is the navel piercing, the piercing that I used to do thousands upon thousands of a year. It is the piercing that people used to line up at noon outside my old studio, and there'd be like 15 of them waiting to get just this piercing. I would spend the entire day doing just navel piercings. So what it is it's done through, there's kind of a natural lobe on the top of your navel. The best way to kind of describe it is take your index finger, stick it in your navel, pinch down, and kind of roll it back and forth. You'll notice there's kind of a lobe there or looser tissue that isn't as fatty. That's generally what we pierce through. Most commonly, this is done either with a curved barbell. That's probably the most common anymore. Also, they've been done with rings or circular barbells in the past. A lot of that comes down to your anatomy, and I'll go into a little bit of that later on, and I'll probably do a separate video on the bottom and on floating navels in the future. Now, as far as the history on this, there's a lot of it that I don't really believe. The myth, the one that was pretty much the one from the beginning, the one started by Doug Malloy, or Malloy. Malloy? Is that how you pronounce it? I never can remember. And the people at Gauntlet, like Jim Ward, was that supposedly this piercing was done by pharaohs as a way to symbolize their connection with the afterlife or the ritual that's involved with it. The other thing is that it was a sign of you being an Egyptian aristocrat, and that somehow this was your ranking, was a sign of your ranking. Now, this piercing was probably developed at Gauntlet, probably maybe late 70s, early 80s. I remember vaguely seeing it in the early 90s on a couple of girls that had gone out to LA and gotten it done. It's not, really didn't hit popularity until we get to the mid-90s period. What made this piercing popular, in my opinion, is the Alicia Silverstone appearance in the Aerosmith video, Crying. She got it done in that video. And that would have been about 1993. Around the same time, a model by the name of Christy Turleton, I don't know. It's in the notes if you need to look it up. Showed off her navel being pierced at a fashion show in London. Both of those things kind of spearheaded this massive movement and massive amount of popularity that this particular piercing gained. Well, with that out of the way and our little history lesson done, let's move on to the pros, the advantages, the things that make you go, yeah, this would be a good piercing for me. The first one is it really does tend to enhance the look of that anatomy, of that area, of that midriff. Kind of gives you a little bit more of a focus on that. Number two, this has a long history of healing. However, it is not always an easy heal. You should understand that going in. Yes, it probably will heal, but it's not going to be easy. Number three, has one of the largest selections as far as choices of any piercing on the planet. There is just, because this piercing was so popular, there is just a lot of different designs and types out there. Now, is that a good thing? Not always. A lot of that stuff is just terrible for it, but it does have a lot of choices. Number 4, doesn't affect lifestyles much. This piercing is not going to affect sleeping as much. It's not going to affect eating. It's not going to affect your diet. It's not going to affect this or that. It tends to be one of those piercings that's less intrusive than healing out other piercings. And the last one, number 5, it is easy to conceal. This is a piercing that if you don't want people to know you have it, you can easily cover up with a shirt during the healing process and afterwards. It's one of those things that it only has to be shown when you want people to know you have it, or, you want to show it off. Before we move on to the cons, if you find this video helpful, entertaining, what have you, give me a thumbs up. Let me know that you liked it, because we like it when you like it. If you haven't already, please subscribe, hit that notification bell so that you're notified every single time we post something. Now let's move on to the cons and disadvantages, the things that we make us go, maybe not. I don't know about this one. The negative stuff. Starting with number 1, this piercing has a long healing period because there's not a lot of blood flow to the area, and it's in an area of the body that moves around a lot. It has a tendency to take anywhere from 6 months to a year or longer. So it does take a level of dedication to heal one of these out. Number 2, those high-waisted pants. I really do believe that the lowrider jeans and that boyfriend jeans style that came about in the 1990s had a lot to do with the fact there were so many females out there getting their navel pierced. At some point in the last 5 or 6 years, somebody must have found a bunch of those Guess jeans that come up to your armpits, or almost, sitting in some warehouse somewhere, and went, oh, these are really cool, we can sell these, or copied them from something they found at a flea market. You cannot wear high-waisted pants against this piercing during the healing process, especially tight jeans. It will cause a massive amount of issues. It was the curse of my existence in the 1990s because of the number of people getting this piercing done and the fact that they all insisted on wearing those jeans. Number 3, can't sleep on this piercing. You need to sleep flat on your back or on your side. Sleeping on the piercing will cause issues. Number 4, the flexibility of this area, because it's kind of in a jointy, or not really a joint area of the body, but an area of the body that moves around a lot, sitting, standing, expanding, and contracting. That can be problematic with this particular piercing. It can affect how you move. It can affect what type of exercises you can do. So it is one of those piercings that it's hard to isolate sometimes. And it's also the location makes it difficult to isolate it. And number 5, pregnancy and weight and loss and gain. I know people try to wear this, and I'll get into this more when it comes a little later on about the pregnancy. I know a lot of people like to save this or try to save it during the pregnancy, but really, usually it does damage the piercing, or at least stretch it out really big. Often, because your body changes so much during that period of time, it's not even in the same spot by the end of it. As far as weight loss and gain, that's going to affect it. If it's massive and quick in either direction, it's going to affect how that piercing looks and where that piercing's at. With the cons out of the way, let's talk a little bit about our merch store. We have plenty of different types of swag that you can purchase. All of it is body art, as in tattooing and piercing related. Check it out. Links are in the description. There's also one of those merch bars down below. Well, let's move on to things to look for, things you should know before getting this done. You should find a piercer that is well experienced doing this piercing. It is not as common as it once was, so there's a lot of people out there that really haven't done that many of these. I do see it kind of coming back, especially in younger females, but it's one of those piercings you really need to kind of do your research and find somebody that knows what they're doing. Placement is key on this one in being able to read your anatomy correctly and put that piercing where it's not only going to look good, but it's also going to heal good. They should be, your piercer should be informative, professional, and willing to make you feel comfortable. They should give you a consultation that covers any risks that are involved with the piercing, what it's going to take to heal it, cross-contamination prevention, what the aftercare is going to be, etc. They should also evaluate the area and decide whether or not you're a good candidate for that particular piercing. Now, the jewelry should be either a 14-gauge curved barbell or larger, as in thicker, or a ring or something circular like a circular barbell. There are some anatomies where I have to say rings work better. Understand going in, as I've already mentioned, you're not going to be able to wear those high-waisted jeans anymore. Do not just put them away. Raid your boyfriend's jeans, or go out and buy some, or hit Goodwill or thrift store. The two best things to wear when you're doing this is stretchy pants that doesn't have that cinched tight waist, especially with that rivet in the back that's constantly banging against your navel. The other type would be hip huggers, low-waisted pants. The other type, another option would be like bibs. They're great because they don't really have a waist. Lastly, you should find out whether or not your piercer does supply aftercare products, if they sell it. If they don't, where you can purchase it, and go ahead and purchase that in advance so you have it on hand. You don't have to worry about that on the day of the piercing. And your piercer should supply aftercare instructions, verbally and in writing, or at least have a video somewhere that you can sit down and watch. Now let's talk about the piercing experience itself. Usually the way this works is you go through a consultation. Your piercer will talk to you about, like I mentioned earlier, aftercare, evaluate your anatomy, select some jewelry, talk to you about things like whether or not you have any metal allergies, and try to find what piece of jewelry is going to work best with your navel and your anatomy. Now understand, this may go against what you pictured in your mind, but it's often better to either not get the piercing or go with the jewelry that your piercer suggests. Oftentimes, this floating navel thing that they call is more like the way we used to pierce navels. Navels used to be pierced more inside the navel and less on the edge. The popularity of the curved barbells drew it out more so that it's done at more of an angle or more flat. Your navel might work better with a ring or more pierced inside your navel, but that may mean that you're not going to be able to see the jewelry, or the jewelry will not fit in there properly. So you really should consider your options, and they should be able to talk you through that process. Next up, you're going to go through a waiver that's going to collect information about you, making sure that you're definitely making a correct decision. This may involve asking questions about any allergic reactions that you have to Medicaid or to any products we're using during the piercing process. Also, any medication you may be on, or controlled substance, and any health conditions you have. Now, if you have any pre-existing health conditions that might impair your body's ability to heal or may affect blood clotting, you should discuss that with your doctor. We do not know one way or another whether or not or how much your condition is going to affect the healing process or getting the piercing itself. Now, the piercing, usually at this point, the piercer will set up their area. They'll go ahead and disinfect the piercing area, mark it, and I suggest marking it while you're standing. Then they'll put you in a reclined position in most cases. I suggest using forceps. I do not like freehand piercings, especially with this one. Condensing that tissue and keeping it straight is going to greatly increase the likelihood of that piercing looking correct to your anatomy. That's also why we want you to do it standing, because that's when most people see the piercing. Once forceps are in place, the needle follows through. Quick, easy. Usually do a breathing exercise involving deep breaths and holding and exhaling. Then the jewelry is inserted. Now, depending on the type of jewelry, they may use a insertion pin that's threaded to push the barbell in and push the needle out. Then it's just the matter of closing the jewelry. This can take sometimes a minute or two. Hopefully not that long, but it can be a pain. Afterwards, you might notice a little bit of slight bleeding. There might be some throbbing or aching. That usually goes away in about 10 or 15 minutes. It's going to be tender to the touch. There's no way around that. You're also going to notice some redness in some cases. Usually, some movements will not feel great, especially because you're stretching and compacting that area on a regular basis when you stand or sit up. It's not uncommon to walk around like a pregnant woman with your belly out. This all will fade fairly rapidly, and you'll get back to normal to a degree. Some bruising can occur on some people. It's very rare, though. With bruising, if you do notice it, if it doesn't go away in a few days, I would suggest going to see your piercer or contacting a medical professional. Now let's talk about healing. The fun part, right? Everybody loves the healing part, don't you? I do. Really, it's so much fun to heal a piercing. Basically, you're going to need to clean this twice a day using a sterile saline spray. Average healing time on these is anywhere from 6 months to a year or longer. They are a slow heal. No way around it. There's no real way to speed it up. Your body either heals at that rate or it doesn't. So you need to clean it twice a day using sterile saline. I don't suggest using Q-tips. Don't move the jewelry, rotate it, do any of that stuff. Just apply the saline, leave it alone, pat it dry, rinse it under running water. That's all you need to do. You're going to need to practice cross-contamination prevention, and that's going to involve washing your hands before you handle it, no oral contact, no exchange of bodily fluids, keeping your environment clean, clothing, bedding, towels, not submerging the piercing in bodies of water you can't control the quality of, which means everything but your own clean bathtub. Also keep pets away from it. Don't let them sleep in the bed with you. The other thing you need to do is you need to avoid sleeping on the piercing. Make sure you're sleeping on your side or your back. Already talked about clothing. You want to avoid things that have a waistband that comes in direct contact with the piercing. Certain movements like stretching, maybe bending over, that sort of thing, are going to be a little uncomfortable at first. That will change with time, but it's best to try to kind of isolate the area and keep things away from it. For the first 3 to 5 days, you're going to notice redness, discolorization, heat, tenderness of touch, and inflammation. You might notice a little bit of slight bleeding off and on for the first couple days, too. That's normal. Leave it alone. It'll be fine. Now let's talk about jewelry. Now, jewelry, the two types I generally suggest, well, there's pretty much 3 or 4 different types. Circular or curved is the easiest way to put this. Curved barbells with the 2 gems on both sides are okay. Stay away from things that have sharp edges, points, things dangling off of it. The more stuff you put in the area, the more likely it is to get caught on things. And even after the piercing is healed, constantly getting it caught on stuff or snagged on stuff is going to cause problems. The other thing is, unless you can confirm what the material is that the jewelry is made out of, if it's shaped, it's got hearts, clovers, bats, all that stuff, it may be made of a substandard material such as sterling, and it may cause issues depending on if you have metal sensitivity or not. It can tarnish. That can cause other problems. The other thing to avoid is things that dangle or hang off of it. That's just basically like fishing. You're just like putting that anchor out there or that hook out there to get caught on things. Now let's talk about living with the piercing. Jewelry should stay in at all times. Only take you out to replace. It doesn't really matter how long you've had it. This piercing can close pretty rapidly, and it's usually a day or so, and you're not going to be able to get jewelry back in. So it's a good idea to leave something in it. Still, some people do still have issues wearing the tight-waisted pants that are in direct contact with it or sleeping on their stomach. Test it out, see if it works okay for you, but the minute you notice any problems or agitation, you need to change clothes. Sorry, it's not going to work. Be cautious, and you should do this during the healing process and that isolation thing. Where it's located at. We have a tendency as humans to put things right on our waist, or we tend to belly up to things. You really want to be cautious of what's having contact with that jewelry on a regular basis. So just be very cautious, kind of isolate the area, baby the area, keep things away from it. It's not uncommon. I've only had 2 or 3 cases of this, but it's not uncommon for them to get caught on like things like seat belts and during an accident, or lifting boxes and getting trapped between like a hard surface in the box or whatever. Just be careful and keep things away from it. And usually in most cases, the real culprit in that is that the jewelry wasn't simplistic. It had sharp edges, points, things dangling off of it, and that's what caused the issue. So simple, easy peasy, leave things away from it, keep things away from it, and be careful. Lastly, let's talk a little bit about pregnancy. I've had clients that have been able to wear it all the way through. Now, I would say that is the minority. Usually, because your body goes through so many changes, even if you can get it all the way through, keep it all the way through the healing process, by the end of it, it's not centered anymore because your body's changed. I know there is a lot of products on the market that are going to say like bioplastic, flexible, navel, pregnancy navel jewelry, blah, 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 blah. The problem with a lot of that stuff is it's not going to alleviate that much pressure. The other problem is nobody knows what the hell it's made out of. You are in a situation where you do not need to be putting any more possibly toxic things in your body. I don't advise bioplastic or acrylic or any of that stuff. It's best if you're getting to the point where there's so much pressure on that navel that it's starting to kind of hollow out the area or stretch the piercing, it's best just to take it out. Sorry. Abandoning the piercing, since we just talked about taking it out because you're pregnant. If you remove it during the healing process, it'll close pretty quickly. You do want to keep an eye on the area, make sure that, just like any other cut on your body, that there is no signs of infection. If there are already signs of infection or other problems, seek medical advice. If you had the piercing for a while and you're just done with it, take it out. It will slowly begin to close. What it'll initially do is it will seal up in the center. It may appear still to be open, but it isn't. And then it'll slowly fill up from the inside outward. Really no special care needs to be taken because it's not an open wound. It will probably take a long time for it to close a great deal. You're probably going to be stuck with this hollow indentation. Often it looks fairly deep, circular holes. That should fade somewhat over time, but it's just part of the healing process in that part of your anatomy. Lastly, sebums does collect inside that piercing sometimes. A sebum is it's the oil. It's kind of waxy that your body produces to lubricate your hair follicles. It also makes you waterproof and healthy and shimmery. With old piercings or abandoned piercings and large gauge piercings, it seems like the body kind of overproduces inside piercings, and it can collect in there, and then when you squeeze it, it comes out as this white, like cream cheese looking substance. It smells really bad. It's not a sign of infection. It's not a problem. Don't worry about it. Well, that's all I have to say today about navel piercings. If you feel like there's anything I missed or you would like to ask a question, please leave a comment. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Thank you for watching, and we will see you in the next video.